Did you know that every year approximately 720,000 people die by suicide? That's almost 750,000 people worldwide. In the United States, suicide is the 11th leading cause of death overall. It's third amongst 15 to 24-year-olds and second amongst 25 to 34-year-olds. And rates are on the rise. Since the COVID-19 pandemic in 2020, suicide rates have gone up about 36%. These statistics confirm that suicide is a serious public health problem, and it's something that lets us know we're in the midst of a mental health crisis. So, would you know how to recognize someone who's in the midst of a mental health crisis? Someone who's at risk for suicide? Hi, I'm Dr. Lori Barker, and I'm a licensed clinical psychologist, as well as an educator and a consultant. And in this video, I'm going to outline for you the major warning signs for someone who is at risk for suicide. And stay tuned, keep watching, because I'm also going to go over the risk factors and demographic characteristics that also put someone at higher risk for suicide. So as you watch this video, it's helpful to think about suicide risk as being on a meter. For example, when I work with my clients in my private practice, as I'm asking them questions and I'm doing a suicide risk assessment and I listen to their answers, I sort of visualize a meter in my head. You remember those old-fashioned thermometers with the mercury that would go up and down depending on the temperature? That's how I think of the risk meter. And as people answer the questions, I think about, are they going up on that meter or are they going down? So let's get into it. What are the warning signs for someone who is at risk for suicide? Number one is talking about suicide. It is a myth that somehow if people are talking about suicide that they're not serious about it, but that is not true. If someone is talking about suicide, you need to pay attention because the statistics show us that most people who either attempt suicide or complete suicide talked about it sometime in that period before. So that means we need to take it very seriously. And a lot of people won't talk about it directly. Some people will talk about it indirectly. Like they may become very preoccupied with death and just talk about a lot of subjects related to death. Or maybe they start researching it online or start looking at people's profiles who have completed suicide. So pay attention to that, even if they're not talking about it directly. Or sometimes people will say things like, I wonder what would happen if I wasn't here anymore. Would anybody miss me? We call those kinds of things passive suicidality. So they're not directly talking about it, but it's still important to pay attention. People may also express feeling like a burden, like thinking that, oh, everybody else, my family members, my friends would be better off if I wasn't here anymore. Or sometimes people express feeling very stuck, like they're in a situation and they just can't see any way out. Another important warning sign is changes in mood. And when we talk about a change, we mean this is something that's not typical for this person, meaning they weren't like this before. So if someone becomes very sad, depressed, they're crying a lot, maybe they become very anxious or tense, or it can also come out as irritability and anger. So any of those kinds of changes in mood. You can also see changes in behavior. One of the changes in behavior that you might see is increased risk-taking. So this person may start driving really fast and recklessly on the road, or they may become sexually promiscuous, or put themselves in situations that they know are not safe. Another change in behavior might be an increase in substance use, like alcohol and drugs. Another change in behavior, sometimes people start giving their prized possessions away. So if it's someone who's an avid collector of something, maybe they collect baseball cards or maybe they collect little figurines, And, this has been very special to them, and all of a sudden they start giving those things away. Or some people will start putting their affairs in order. If they don't have a will, maybe they write a will. Maybe they start paying off all their bills. Maybe they make sure that there's going to be someone who will take care of their pet if something happens to them. So I mentioned paying off bills, but also a risk-taking behavior. Sometimes people will run up their credit cards all the way to the limit, right? Maybe they'll go on a shopping spree, or they'll start buying extravagant things. And again, this is a change. This is something that they've never done before. Another change in behavior that you might see is if this person has been in a lot of anguish, a lot of distress, and they suddenly become calm and serene. That is a big red flag, because what may have happened, if someone is battling with themselves, should I kill myself? Should I not kill myself? And they make the decision to do it, they're not in anguish anymore because they've made a decision. So if you notice someone who was distressed, they were upset, and all of a sudden they become calm and serene, that can be a significant warning sign. Another change in behavior or behavioral sign that you might see is the person may start saying goodbye. Again, this could be explicit. They may call and literally say goodbye, but this is also something that might be more subtle or more passive, where they suddenly call and start saying how much they love you and how much they appreciate your friendship or relationship or everything that you've done for them. Again, if this seems to be coming out of nowhere, you want to pay attention to that, because that could be a warning sign. So I mentioned at the beginning of this video that we wouldn't just go over warning signs, but I would also give you some of the risk factors for suicide. So here we go, some of the risk factors. Now, what's a risk factor? Risk factor is anything that increases the chances that something might happen. So in this case, we're going to talk about things that increase the chances that somebody may attempt or complete a suicide. So one of those risk factors is if they have a history of trauma, and that could be any kind of trauma. That could be child abuse, it could be intimate partner violence, it could be they went through a terrible accident, or they witnessed a terrible accident. Any kind of trauma puts that person at risk for suicide. If they have ever or recently actually experienced some kind of significant loss. So that could actually be the loss of a loved one, but it also might be some other kind of meaningful loss, like loss of a job, loss of their home, the end of a romantic relationship. Along those same lines as a significant loss is if that person has recently gone through a life, like a major life transition. That could be something like they recently graduated from high school and moved away to college, or they recently graduated from college and they're trying to figure out what to do next. They recently started a new job or moved to a new city. Maybe they just got married or they had a baby. And a lot of times we think of these life transitions as positive, but these can be very stressful and difficult for people to deal with. So if someone is going through or has recently gone through a major life transition, that is a risk factor. So as I mentioned, these life transitions can be stressful, and stress is another risk factor. So someone who, for whatever reason, is under a lot of stress, that makes them go up on the risk meter. Another risk factor is social isolation. So sometimes this is by choice. Like, let's say if it's someone who's very, very depressed, or they're very sad, or again, they've gone through something stressful, they may choose to separate themselves from their family members and friends. But the social isolation may not be by choice. Maybe this is for whatever reason, the person doesn't have a lot of family members and friends or positive relationships. In other words, they don't have a strong, supportive social network. That is another thing that can put someone at risk for suicide. Along with that is if the person has attempted suicide in the past. That means that barrier has already been crossed. So if they've done it before, that increases the chances that they will do it again. Similarly, if someone has a family member or a close friend who has died by suicide, they also go up on the risk meter. Again, what that does is it lowers some sort of barrier, right? It reduces the stigma or the taboo against suicide and makes it more acceptable or easier for that person to attempt themselves. Another risk factor is someone who's been diagnosed with some other mental health issue. So, for example, if that person has been diagnosed with major depressive disorder, that puts them up on the risk meter. Bipolar disorder, where they not only get depressed, but they also go to the other extreme and get very manic, have lots of energy. Borderline personality disorder is another diagnosis that puts someone at higher risk for suicide, as well as, we mentioned before, any type of substance abuse disorder. Also, we need to pay attention to the person's plan. So if the person has a specific plan for how they are going to attempt suicide, they go up on the risk meter. It's important to know what that plan is, because one of the risk factors is if they have access to the means. So for example, if that person plans to overdose on some sort of medication, that's an easy one because almost everybody has a medicine cabinet with some sort of medication in there. But one of the biggest risk factors is access to a firearm. About 50% of people who complete suicide do it using a gun. So by far, the most common way that people attempt or complete suicide is by using a gun. So if we can limit their access to means, in particular, if we can limit someone's access to a firearm, we can save a life. So those are the risk factors. In other words, if those things are present, they increase the likelihood that someone may attempt or complete suicide. I also promised you that I was going to talk about some of the demographic characteristics that increase risk for suicide. One of those is gender. There is a difference between men and women when it comes to suicide statistics. Men more often complete suicide, whereas women more often attempt suicide. And when we look at the trends and the patterns, that seems to be because men tend to use more lethal means. Like I just gave the examples of overdosing on pills versus using a gun. Using a gun is much more lethal, meaning if somebody does that, they're more likely to die. And so the thinking is that men tend to use more lethal methods than women, and that's why we see that gender difference. Another risk factor is marital status. So someone who is single, and this is connected, remember that risk factor of social isolation. So if someone is single for whatever reason, whether single never married, whether they're divorced, they're widowed, they just went through a breakup, someone who is single is at higher risk for suicide. We can also look at age. Elderly people, our seniors, are at greater risk. In particular, men over the age of 75. We can also look at sexual orientation. And here it's more specific to our LGBTQ plus youth. Many of you have probably heard that, but the rates for LGBTQ plus youth are proportionately higher than other youth and people from other groups. We can also look at our veterans. They are another group that is vulnerable. And what about race or ethnicity? Now, this one might surprise you a little bit. In terms of people of color, the group that's at greatest risk are Indigenous people or Native Americans. They have disproportionately higher rates. The other group is white people. Again, our stereotypes might be that people of color are at greater risk or under more stress because of their status in society, but actually somehow Race and ethnicity seems to be a protective factor, meaning that lowers their risk. So when we look at the differences between the different racial or ethnic groups, white people are actually one of the groups at highest risk. So here we are. We've gone over the warning signs, the risk factors, some of the demographic characteristics that we can look at in order to assess the situation and see whether someone is at higher or lower risk for suicide. And it's important, I'm glad you're watching this video, because it's important for us to educate ourselves and increase our awareness, because then we have the opportunity to intervene. We have the opportunity to save a life and to make a difference in this mental health crisis that we're going through right now. So you might be wondering, what's next? Now that I know how to identify someone who's in a mental health crisis and who might be at risk for suicide, what do I do? Well, there are very specific steps that you can take to help keep someone safe and maybe even prevent a suicide. And I outline those action steps in another video. So follow this link up here to that video where you can learn how to intervene with someone who's in a mental health crisis. Also, I have posted some resources down in the description for this video, so be sure to check those out and be sure to share them with other people. I thank you so much for watching this video and for helping to take part in improving your mental health as well as the mental health of other people, and so that we can all live our best lives. Thanks so much for watching, and I'll see you in the next video.